You've had issues either getting pregnant or staying pregnant, and your infertility doctor has suggested a protocol which involves something called IVIG. But what is this? And how's it going to help you have a baby? Recurrent pregnancy loss, or RPL, affects an estimated 23 million women and couples annually and is emotionally, physically, and mentally devastating. Many will turn to fertility specialists to assist them with improving their success with conception and maintaining a healthy pregnancy after they succeed in conceiving. Now, there are multiple protocols that you may be prescribed, but in situations where causes are potentially autoimmune in nature, evidenced by multiple egg implantation failures after in vitro fertilization or repeated miscarriage, IVIG may be used alongside other implantation-enhancing therapies such as endometrium and Lovenox. Intravenous immunoglobulin, or IVIG, is a plasma derivative, meaning it's made from whole blood, which is then processed to separate the plasma, which is this light amber color liquid seen here. The term immunoglobulin is synonymous with the term antibody. So every time I refer to IVIG, think of it as me saying intravenous antibodies. And this plasma accounts for 55% of the body's total blood volume. But the one element that we're most concerned with in it is the immunoglobulin G part of the plasma, or IgG. And a side note, throughout the rest of the video, I'll refer to immunoglobulin as Ig. Now, IgG is one of 5 main antibodies which are responsible for immune responses against all kinds of things, all variations: bacteria, viruses, fungus, parasites, chemicals, toxins, anything that brings an insult to your body in some fashion. The others include IgA, IgM, IgE, and IgD, which I remember by the word gained. And each of these immunoglobulins have specific functions. And out of these 5, IgG is the most dominant immunoglobulin present in human serum. So IgG is produced as part of the secondary immune response to an antigen. So to clarify, your primary immune response occurs after you've been exposed to something that's foreign to your body and results in the generation of memory immune cells. Now, these memory cells are what help your immune system recognize an invader the second time you're exposed to it and launch an attack, or a secondary immune response. So IgG comes into play only after your body has been exposed to an invader and recognize that it's been infected by it before. So IgG constitutes approximately 75% of the total immunoglobulin found in plasma, and it's been shown that starting IVIG before conception improves the live birth rate. Now, there are varying statistics on just how effective this therapy is. I won't go too deep into things, but it's important that you understand the next bit of information. So specifically, IgG has multiple functions, including the inhibition of autoantibodies, the downregulation of natural killer cell toxicity, and the suppression of helper 1 T cell cytokines. So you can think of autoantibodies as misguided cells, for lack of a better explanation. And instead of reacting to an invader, they respond to your body's own proteins, leading to, in some cases, an abnormal immune response that attacks the cells, tissues, and organs, and in some cases, the placenta and the unborn baby. According to some specialists, IVIG has been established as one of the most effective treatments for multiple miscarriages. And there are several reasons for its usefulness in recurrent pregnancy loss, which include IVIG helping the embryo to shield itself against the mother's immune system, suppressing many of the immune reactions which commonly attack an embryo, increasing the production of substances which assist with embryonic growth, and blocking the transmission of negative information about the baby to the immune system as if it's shielding it. An example of this is Rh factor, which is a molecule on the surface of red blood cells in some people. And it plays a role in pregnancy where the mom's immune system may identify the baby's red blood cells as foreign and produce antibodies against them, and these are called Rh antibodies. The very presence of a fetus and placenta alters maternal immunity to help sustain and protect a pregnancy. So, in general, the maternal immune system is well prepared to control infections while also ensuring the survival of your baby. A large percentage of women who have experienced recurrent miscarriage have found that IVIG is an effective solution to the immunologic causes of miscarriage. Normally, when you go to a fertility clinic, you and your partner will be tested for a multitude of possibilities, which include antiphospholipid antibody syndrome, which can basically lead to a woman producing clots, which can affect blood flow through the placenta, and ratios of helper 1 T cells to helper 2 T cells, which protect against bacteria and parasites, and anti-nuclear antibodies, or ANA, which indicates the presence of antibodies that can potentially attack healthy cells and drive inflammation. So the role of an autoimmune response in conception and pregnancy is still really unestablished, but it's being heavily researched, and our understanding of its role is vastly increasing. So there are several well-known autoimmune conditions that could contribute to recurrent pregnancy loss, including lupus, rheumatoid arthritis, inflammatory bowel disease, celiac disease, thyroid issues, and anti-sperm antibodies. The dosage and duration of IVIG administration for the treatment of RPL are also controversial. Additionally, IVIG is typically considered as an off-label treatment, meaning it's not approved specifically for this use by the FDA. So it may trigger a denial by your insurance company depending on the circumstances. Not always, but a lot of the time. If you find yourself in a place where this is being prescribed for you, how will it be administered and what can you expect? Now, in my research and experience, the dosing and duration of treatment varies slightly with different study protocols. So some specialists will use higher doses of IVIG for shorter periods of time, and then the opposite is true. Some will use lower dosing of IVIG for longer gestational periods, and others will only give one cycle of IVIG once during the conception period or just prior to egg retrieval, followed by one more dose after a positive confirmation of pregnancy. So, in general, the dosing ranges between 200 to 500 milligrams per kilogram of body weight, usually falling somewhere in the middle around 400 milligrams per kilogram. And this is given anywhere from 7 days to 24 hours prior to embryo transfer if using IVF, and then may be continued at regular intervals during pregnancy until a few weeks prior to delivery. And I'll list all of the articles that I used for my research in the description below. So this can be a really harrowing experience for many couples. You know, you're visiting a fertility specialist, you've had probably long-standing issues of either multiple miscarriages or recurrent pregnancy loss, issues with conception. Maybe you've already tried, ovulation enhancing medication. It can be a marathon. It is a tough problem to deal with. I have many friends that have gone through it. I know the heartbreak. I know the frustration, the feelings of hopelessness. So we've come such a long way with assisting nature in conception and becoming pregnant. So this is just one part of that protocol. There are a million of them. There are drugs to help with ovulation, as I said. There are drugs to help with implantation. There are drugs to help maintain hormone levels throughout pregnancy. So we can assist these things today. So that gives a lot of people hope. And by the way, this video was a request of one of my viewers, hi Sandor, and they were going for IVIG and they didn't really understand what the dosing was like, specifically in the treatment of fertility. They were able to find a lot of information about IVIG, but it was not explained in terms of how it helps recurrent pregnancy loss or issues with conception. So I want to thank him and his wife for suggesting this topic. Now, depending on your specific circumstances and health history, your protocol will be tailored to your needs. IG happens to be the only immunoglobulin that crosses the placenta and protects your unborn baby from infection, so it is the most abundant antibody present in newborns as well. On the day of your infusion, you'll be given any pre-medications that your doctor has ordered, such as Tylenol or maybe anti-nausea medication. It's very, very important to also hydrate really, really well prior to IVIG, as this helps your kidneys flush it through your system. And it also has the added bonus of helping to plump up your veins so the nurse has an easier time of getting an IV catheter in place. Common side effects include a headache, and it can be a pretty significant headache. So the better hydrated you are, the less likely you'll be to have this. And if you have morning sickness, then this may also predispose you to having some nausea during the IVIG infusion. So some of my moms will find relief with ginger or vitamin B6, which is paroxetine, or mint. You can expect the infusion to take a few hours usually, so be sure to wear comfortable clothing, bring snacks, and use this time to maybe take a nap. You'll be able to get up as you need to, but you may be a bit tired or fatigued afterwards, so I'll normally suggest to take it easy after your infusion. So that's going to do it for today. I'm Danielle Minetti, and this has been Lucid Med. If you made it all the way to the end, hit subscribe and join our community. Or if you'd like to support us in another way, send a super thanks or check out our Patreon. I normally upload every Sunday and encourage you to comment. I answer every single one. Or hit like, share, subscribe, do all the things, hit all the buttons. And if you have a topic you'd like me to cover, then email me at danielle@lucidmed.com or message me in the comments. Over the next few weeks, I'll be doing a video on small fiber with one of my colleagues who's an expert on this subject. So I hope to see you there. And in the meantime, stay healthy and lucid.